Imagine this: we step into a clinical diagnostic room where every second feels like a ticking clock, the stakes high, the air heavy with urgency. In this environment, precision is everything, and the smallest delay or error could mean the difference between a quick, effective intervention and a dangerous progression of disease. We've been here before, relying on human eyes and experience alone, aware of the limits that even the best professionals face. Now, however, the scene is dramatically changing. Picture an AI system standing beside us not as a replacement, but as an ally. This is a new era of medical diagnostics, where technology augments our abilities, complementing our expertise. The AI processes data in mere moments, analyzing imaging scans, lab results, and patient histories all at once, faster than we ever could. It spots patterns hidden in the data, subtle indicators that might escape even the most trained eye. What used to take hours or days now happens in real time. This isn't about reducing our role or cutting corners, it's about accuracy and efficiency. We no longer face the burden of manually sifting through mountains of data, second-guessing ourselves or worrying about the fatigue that inevitably sets in after long shifts. The AI's algorithms constantly learn from vast datasets, identifying potential errors before they happen, flagging abnormalities, and suggesting next steps based on the latest medical research. In a field like medicine, where time and precision are critical, this partnership with AI doesn't just save time, it saves lives. Every moment spared means a quicker diagnosis, a faster treatment plan, and ultimately, a better outcome for the patient. The machine learns from every case it encounters, adapting, evolving, becoming a more refined tool in our hands. And with it, we become more than we ever could be alone. We no longer have to imagine a world where technology works seamlessly alongside us in healthcare. It's happening now, and the potential is limitless. Together, we are revolutionizing the future of medical diagnostics, one precise result at a time. Artificial intelligence AI is transforming healthcare in ways we could have only imagined a few years ago. As we delve into this, we must recognize that AI is not just a futuristic concept anymore, it's here, reshaping the way we approach medicine, patient care, and even the diagnosis process. Let's picture ourselves in a busy hospital. Traditionally, many tasks here, such as analyzing patient data, reviewing medical images, or even scheduling appointments, were manual processes that consumed hours of a healthcare professional's day. Now, AI steps in, and suddenly, these tasks are automated. Medical records, once laboriously maintained by hand, are now efficiently processed by algorithms in a matter of seconds. For us, as healthcare professionals, this means more time to focus on what truly matters: patient care. One of the most significant breakthroughs AI brings to healthcare is in the realm of diagnostics. Imagine a scenario where a radiologist is reviewing a CT scan for potential signs of lung cancer. Before AI, this task would rely solely on the human eye, and despite the expertise of the professional, errors were always a possibility: missed details, variations in judgment. Now, with AI-powered tools, we can analyze medical images with unparalleled precision. These systems can detect patterns, even the most subtle anomalies that might go unnoticed by a human eye. For instance, machine learning models can be trained to recognize the early signs of cancers or heart diseases, reducing diagnostic errors and enabling early intervention. But it doesn't stop at imaging. AI is also revolutionizing how we approach patient data. We can now feed large datasets, genomic information, patient history, and even lifestyle factors into AI models, and in return, receive highly personalized treatment recommendations. This is the promise of precision medicine, where treatments are tailored to the individual, maximizing efficacy and minimizing side effects. And then, there's the challenge of data overload. Every day, vast amounts of data are generated in the medical field, from lab results to clinical trials to patient feedback. Sorting through this data manually would be overwhelming for any healthcare team. However, AI algorithms can sift through these enormous datasets in real time, identifying key trends, potential risks, or even predicting outcomes based on previous cases. This predictive capability helps us make more informed decisions, from suggesting preventive measures to optimizing treatment plans. For healthcare providers, integrating AI also means a more seamless experience with electronic health records (EHRs). Many of us have faced the challenge of navigating complex EHR systems, but AI is now streamlining this process. Voice recognition technologies can now transcribe notes directly into the system, and AI-driven recommendations can flag potential medication interactions or suggest follow-up tests before we even have to think about it. The efficiency gains are remarkable, allowing us to spend more time with our patients and less time buried in administrative tasks. Moreover, AI is being used to enhance robotic surgery, bringing precision to a whole new level. Picture this: a surgeon, assisted by an AI-powered robotic system, performs intricate operations with near-perfect accuracy, minimizing the risk of human error. These systems can even learn from previous surgeries, continuously improving their performance. It's a partnership between human expertise and machine efficiency that's setting new standards in surgical outcomes. In terms of cost efficiency, AI is also making healthcare more accessible. By streamlining processes, reducing diagnostic errors, and predicting outcomes, it's lowering the financial burden on both institutions and patients. For those in remote areas, AI-powered telemedicine platforms are bridging the gap, providing access to expert consultations without the need for physical visits. This, in turn, reduces strain on overcrowded facilities and ensures that quality care reaches even the most underserved populations. As we stand on the cusp of this AI-driven revolution in healthcare, it's clear that the potential is vast. However, we must also acknowledge that this transformation comes with challenges. Data privacy, the ethical use of AI, and the need for rigorous oversight are all crucial considerations. We must ensure that while we embrace this technology, we also uphold the highest standards of patient care and trust. In this new era, we're not just doctors, nurses, or technicians. We are partners with technology, working hand in hand with AI to deliver faster, more accurate, and more personalized healthcare. The future of medicine is not just about treating disease, it's about preventing it, predicting it, and personalizing every aspect of care. And AI is leading the way. Imagine us sitting in front of our computers, sifting through piles of patient data, lab results, imaging scans, clinical notes, manually compiling them into detailed diagnostic reports. We'd spend hours, sometimes days, analyzing every bit of information to ensure nothing was missed. This task wasn't just time-consuming, it was also mentally draining. And let's be honest, no matter how meticulous we were, the risk of human error always loomed. Misplaced decimal point, a misinterpreted result, or simply exhaustion creeping in after hours of monotonous work could lead to mistakes with potentially serious consequences. Now, fast forward to today. With the integration of artificial intelligence into healthcare, we no longer need to endure this laborious process. AI has transformed how we approach diagnostics. Reports that used to take hours or even days to produce are now generated in a matter of minutes, accurately and efficiently. The secret behind this revolution lies in the ability of AI to process vast amounts of data at lightning speed. Algorithms, trained on massive datasets, can scan through patient records, lab results, and imaging studies faster than any human ever could. Not only that, but these systems learn from the data, refining their processes over time, allowing them to spot patterns we might miss and reduce the likelihood of errors. This shift is not just about efficiency, it's about precision. AI systems can integrate multiple data points, everything from a patient's genetics to their medical history and lifestyle factors, to provide a comprehensive overview of their health. By analyzing this complex web of information, AI can suggest diagnoses or highlight areas of concern, giving us insights that might have been obscured in traditional manual analysis. We're no longer bound by the limits of human attention or stamina. AI doesn't get tired, it doesn't lose focus after hours of work. The reports it generates are consistent, objective, and immune to the biases or errors that can sometimes cloud human judgment. This is a game changer for healthcare. It allows us to focus our energy where it matters most, on interpreting the findings, making clinical decisions, and providing care, rather than being bogged down by administrative tasks. The benefits extend beyond time saving. By automating the generation of diagnostic reports, We reduce the risk of burnout among healthcare professionals. We also improve patient outcomes by delivering faster, more accurate diagnoses. And let's not forget about the scalability. AI can process the data of hundreds or even thousands of patients simultaneously, making it an invaluable tool in large-scale health interventions or during public health crises, where rapid analysis is crucial. We're standing at the intersection of medicine and technology, where the power of AI is unlocking new possibilities. By automating repetitive tasks like report generation, we're reclaiming time to do what we do best: care for our patients with accuracy, empathy, and a focus on their well-being. We're living in an era where technology has moved from simply being a tool to an integral part of our daily lives. It's fascinating how quickly it's advancing, taking on tasks that once seemed impossible. We no longer need to handle every repetitive, tedious job ourselves. Machines, powered by artificial intelligence and automation, are now stepping in, and they're doing it with a level of precision we could never achieve on our own. Imagine the repetitive tasks in healthcare, those routine, yet critical jobs that have long required hours of human effort. Enter automation. Now, robotic systems and AI-driven algorithms can take over tasks like monitoring vital signs, managing patient records, or even assisting in surgeries. And they don't just relieve us of these tasks, they perform them flawlessly, minimizing the risk of human error. This means we can spend less time on data entry or double-checking, and more time where it truly matters: caring for the patients. Consider how it has revolutionized diagnostics. We're now able to use advanced machine learning algorithms to analyze medical images, identify patterns, and even predict the onset of certain diseases. Machines don't suffer from fatigue or distraction like we do, so their accuracy can often surpass even the most experienced professionals. And the benefits extend beyond accuracy. This technology works around the clock, processing vast amounts of data in a fraction of the time it would take us. For us in the medical field, this is groundbreaking. It allows us to shift our focus from mundane tasks to more complex, human-centered work. We're empowered to use our knowledge and skills where they're most needed, while technology handles the laborious, repetitive elements that once consumed so much of our time. As a result, patient care becomes more personalized and efficient. We're not just talking about automation in diagnostics or record keeping either. Robots are performing surgeries with unparalleled precision, reducing the risk of complications. They never get tired, never tremble, and their movements are exact to the micrometer. Meanwhile, AI is helping us develop personalized treatment plans based on vast amounts of patient data, something that would have taken us days or weeks to analyze by hand. All of this progress in technology isn't just about making our jobs easier, it's about improving health outcomes. By minimizing human error and speeding up processes, we're ensuring that patients receive faster, more accurate diagnoses and treatments. This doesn't just save time, it saves lives. In a way, we're stepping into a new era of healthcare, where humans and machines work in harmony. We're leveraging technology to handle the tasks we once thought only we could do, but with far fewer errors. And with every improvement, we're moving closer to a future where healthcare is more efficient, precise, and patient-focused than ever before. We're living in a fascinating time where artificial intelligence AI is revolutionizing the way we approach healthcare. But it's not just about streamlining administrative tasks or assisting in diagnosis. The real marvel lies in how AI is now being used to pinpoint organs and lesions with extraordinary precision, transforming dosimetry, an essential element in radiotherapy and complex diagnostics. In radiotherapy, for example, accuracy is everything. We know that targeting cancerous tissues while sparing healthy ones is a delicate and highly complex process. Traditionally, this required skilled professionals meticulously planning each treatment. However, AI is now stepping in, helping us automate and enhance this critical step by precisely mapping out the patient's internal structures. With advanced algorithms, AI can analyze medical imaging, like CT or MRI scans, at a level far beyond what the human eye can discern. It segments the organs and identifies even the smallest lesions, ensuring that we deliver the exact dose of radiation to the cancerous area, while avoiding healthy tissue. This accuracy is critical, as it reduces the potential side effects of radiation therapy, such as damage to surrounding organs, and improves overall patient outcomes. Furthermore, AI-powered segmentation aids in complex diagnostics by identifying abnormalities that might otherwise be missed or misclassified. It interprets medical images with incredible speed and precision, offering doctors another layer of certainty in their assessments. As a result, we can make quicker, more accurate diagnoses, which means patients begin treatment sooner and with a higher likelihood of success. The future of healthcare is increasingly intertwined with these technologies. By integrating AI into dosimetry and diagnostic processes, we're not just improving how we treat disease. We're fundamentally reshaping the patient experience, providing hope for more personalized, effective treatments with fewer risks. Without AI, the segmentation process can be highly subjective, depending on who is analyzing the data. Imagine we're in a room, surrounded by a team of specialists, each trained in the nuances of their field. We're all looking at the same dataset, perhaps medical scans or genetic markers, and as we sift through the details, we notice something interesting. One of us points out an anomaly, a small, indistinct shadow on the scan. Another expert in the room disagrees, saying it's likely just noise, nothing to worry about. A third person, experienced but with a slightly different focus, suggests it could be something entirely different, perhaps a benign irregularity. This is the fundamental challenge we face when humans are the sole arbiters of data analysis. Each of us brings our unique perspective, shaped by our training, our experience, and even our subconscious biases. While these diverse viewpoints can be beneficial, they also introduce a troubling inconsistency. If we aren't all seeing the same thing, how can we make the best decisions? How can we trust the outcomes of our analysis if it varies so drastically depending on who's in the room? This is where artificial intelligence steps in, and why it's so transformative for fields like healthcare. With AI, we can eliminate these subjective variations. We no longer have to worrying that one person might miss something crucial, or that someone else might overinterpret an insignificant detail. The algorithms used in AI are trained on vast amounts of data, learning from thousands, sometimes millions of examples. They recognize patterns that we, as humans, might overlook. And more importantly, they do it with a level of consistency that's impossible for any one of us to replicate. Let's take the example of medical imaging. When an AI system analyzes a scan, it's not influenced by fatigue, stress, or personal interpretation. It applies the same rigorous criteria every time, ensuring that no matter who is overseeing the process, the results are consistent. This doesn't just reduce errors, it also speeds up the entire process. Where we might spend hours or even days debating a finding, AI can process and analyze the same information in minutes, offering insights that are both precise and reliable. But the benefits go beyond just consistency. By reducing human error, AI also reduces the potential for harm. In healthcare, where a misdiagnosis or misdiagnosis can have life-altering consequences, the importance of this cannot be overstated. With AI, we can ensure that patients receive more accurate diagnoses, leading to better treatment plans and improved outcomes. This isn't just a technological advantage, it's a matter of life and death. Of course, we're not saying AI is perfect. It's still a tool, one that requires human oversight and judgment. But by incorporating AI into our workflow, we can significantly enhance our ability to make informed, data-driven decisions. It's like having an extra set of eyes, ones that never tire, never miss a detail, and always apply the same level of scrutiny. In essence, AI allows us to bridge the gap between human intuition and data-driven precision. It provides the consistency we need, reducing the variability that can so easily lead to mistakes. And in a field like healthcare, where the stakes are incredibly high, that's a game changer. We're witnessing a revolutionary shift in healthcare, one that places artificial intelligence AI at the heart of medical diagnostics. Imagine walking into a clinic where advanced AI tools are seamlessly integrated into the workflow, analyzing medical images, lab results, and even patient histories with unparalleled speed and accuracy. The result? Faster diagnoses, greater precision, and a drastic reduction in the variability that often occurs between human professionals. By incorporating AI, we are not only improving the efficiency of the diagnostic process but also elevating its consistency. Traditionally, the diagnosis of complex conditions such as certain cancers or neurological disorders relies heavily on the experience and judgment of individual clinicians. This can lead to differences in interpretation based on who is reading the data or which specialist happens to be involved. However, with AI, we are moving towards a system where these interpretations become more standardized, supported by vast datasets and machine learning algorithms that can recognize patterns invisible to the human eye. This shift means that medical professionals can now focus their attention where it truly matters, on the patient's treatment and recovery, instead of spending hours combing through imaging scans or laboratory results. Physicians can now rely on AI to highlight key areas of concern, allowing for quicker interventions. The time saved here is invaluable time that could be the difference between life and death in critical cases. Moreover, the precision that AI brings to diagnostics is extraordinary. We are talking about algorithms that can detect the smallest anomalies in imaging scans, catching diseases at their earliest stages, sometimes even before symptoms manifest. This kind of early detection can lead to better outcomes, as treatments are often more effective when conditions are caught early. In essence, AI acts as a second set of expert eyes, refining the diagnostic process in ways that push the boundaries of what was previously possible in medicine. By using these AI systems, we are reducing the strain on our healthcare professionals, allowing them to dedicate more of their energy to developing treatment plans, consulting with patients, and delivering hands-on care. This not only enhances the quality of care patients receive but also mitigates burnout among healthcare workers, a growing concern in the medical field. Imagine a future where doctors are not overwhelmed by administrative tasks or data interpretation but are fully engaged in their primary mission, healing. Artificial intelligence isn't replacing doctors, it's empowering them by speeding up diagnoses and ensuring they are more accurate and consistent, as helping us create a healthcare system that's more responsive, more efficient, and ultimately more humane. We're only scratching the surface. With each new step forward, artificial intelligence reshapes the landscape of medicine, pushing the boundaries of what was once deemed impossible, and the impact it touches all of us, from doctors to patients, and the ripple effects are undeniable. AI is not just a tool, it's revolutionizing the way we understand, diagnose, and treat health conditions. Take diagnostics, for example. In the past, the process of identifying diseases often took days, if not weeks. Today, with AI algorithms, we can analyze medical images or genetic data in a fraction of the time. The power of machine learning allows us to detect abnormalities like tumors or genetic mutations that might have gone unnoticed by the human eye. This isn't just about speed, it's about accuracy. Every second counts, especially in fields like oncology, where early detection can mean the difference between life and death. With AI, we're catching diseases at earlier stages, giving patients a fighting chance before symptoms even appear. But perhaps what is most fascinating is how AI reduces human error. Medicine is a field built on precision, but humans are fallible. Fatigue, complex cases, or even information overload can lead to mistakes, sometimes catastrophic ones. AI doesn't tire. It processes vast amounts of information without missing a detail, providing doctors with insights they might not have considered. We're not talking about replacing doctors, but enhancing their abilities, acting as a second set of eyes, ensuring no stone is left unturned. And while it may sound counterintuitive, AI is helping us deliver even more humane care. With the automation of time-consuming administrative tasks, doctors and nurses can spend more time focusing on what really matters, the patient. We've seen it firsthand: more meaningful patient interactions, better communication, and a renewed sense of empathy in healthcare. By taking care of the routine, AI gives us back the time to care on a personal level. It's as if technology, in all its complexity, is bringing us closer to the very essence of medicine, the human connection. The future of healthcare is not just about machines and algorithms. It's about how we, as Humans can work alongside these innovations to create a system that's faster, more accurate, and, above all, more compassionate. We are on the brink of a new era, where what was once thought impossible is now within reach. And with each breakthrough, it's clear that we're not just improving medicine, we're reshaping the very future of health for all of us.